Hello, welcome to SkepVet TV. I'm Dr. Brennan McKenzie and I'm the SkepVet. Today I want to talk about placebo effects in animals. I think this will be an interesting one for a couple of reasons. One, most people are under the impression that placebo effects don't apply to animals, that you have to have beliefs about the medicines that you take for a placebo effect to work. And as you'll see, that's actually not true. The other is that placebo effects not being a problem in animals is often used as an argument in favor of therapies that may not have good evidence or may not actually work. People will say this therapy or that therapy has to work because it works in animals and there's no placebo effect in animals. So what we'll find is that when you test therapies, drugs, or other kinds of medical treatments on animals, on dogs and cats, you will actually see placebo effects in those clinical studies. And that can lead you to think that these therapies work even if they don't really. So let's start with what is a placebo. The general idea is that a placebo is some kind of magical mind over matter effect. If you believe that something will cure your disease and you take it, then it will cure your disease. That's not actually what the placebo effect is. In reality, placebo effects simply influence how you feel about your disease. If you take a medication for pain, and it's actually a placebo, but you think that it's a powerful pain medication, you may actually feel less pain. You may perceive less discomfort. However, many of the things that the placebo effect influences are only subjective impressions. So for example, placebo effects may work for pain, for nausea, for fatigue, for headaches, for things for which there is a significant psychological component. How I feel about my discomfort influences how I experience it. Placebo effects, however, don't typically work for more objective measures of health. Placebos don't make tumors smaller, for example. Placebos aren't going to make you live longer or make the outcome of a surgery better. So we have to be a little bit careful about thinking that placebos are truly healing us. They may make us feel better, and that has some value for sure, but they probably aren't actually changing the underlying state of our health. One really good example of this was a study done in people with asthma. So in this study, they gave people with asthma inhalers that had what are called bronchodilators in them, that opened up the airways and helped your lungs to breathe better. They also gave them placebo inhalers, that is, inhalers that had nothing in them at all, and they treated them with acupuncture. What they found was that the people who were treated with the real inhalers that affected their lungs, with the placebo inhalers, and with the acupuncture, all felt better. They all felt like their asthma attacks were less severe. So if you had asked them, is this helping you, they would all have said yes. However, when they measured the effect on lung function, whether people were actually able to breathe better, only the inhaler with a real medicine in it made those people breathe better. The acupuncture and the placebo inhaler didn't have any effect on lung function. So what does this have to do with dogs and cats? How is this useful in veterinary medicine? Well, again, interestingly, even though our dogs and cats don't really have opinions about their healthcare, they don't necessarily have beliefs about whether the therapies we use actually work or don't work, they do experience placebo effects. And there are a couple of ways this works. The first and most obvious is what we call the caregiver placebo. If I have a dog who comes in with their owner because the dog is limping and it's getting older and the owner feels like it has some arthritis and is painful, and I do an exam and x-rays and I find, yes, the dog does have arthritis, and I give the owner a supplement, something like glucosamine, for example, and I say, try this and let's see if it helps. Well, 2 weeks later, the owner will come back and say, yeah, my dog is walking better, he seems more comfortable, this is really working. Now, if I take that same treatment and I compare it in a clinical study to a medical therapy like a non-steroidal anti-inflammatory drug, for example, and everybody in the study is blinded, meaning they don't know whether the dogs are getting the real therapy or the placebo, it turns out that a lot of times those therapies aren't actually working. Glucosamine, for example, doesn't seem to help dogs if it's given in a blinded study. But almost everybody I give it to in clinical practice seems to feel like it helps. So why is that? Well, that's because as human beings, we care about the welfare of our pets, and we have a tendency to see what we hope for, what we want to see, what we expect to see in the effects of any treatment that we give them. And since we can't ask the pets directly, these subjective measures, these opinions or impressions from caregivers, including veterinarians, are often more positive than the real effects of the therapy that we're testing. So in a clinical study, we may not know whether we're giving a real treatment or not, and it turns out that about half the time the veterinarians and the owners report improvement even when the dogs or cats are getting placebos, fake treatments that aren't doing anything at all. So this caregiver placebo effect is a real problem in the everyday real world that I work in as a clinician. I have people coming in all the time saying that this therapy, which maybe I know from clinical studies doesn't actually work, is making a huge difference for their dog. The problem there is that those animals are still in pain. We just don't see it because our beliefs and our expectations have been affected by the placebo effect. So the caregiver placebo effect is a real problem, and what we have to be aware of is that we need good scientific research studies to show us that our treatments actually do work. We can't just rely on our impressions as owners or as veterinarians about whether they work, because it turns out we're often wrong. We're often seeing what we expect and hope for. Interestingly, there are some other ways in which placebo effects show up in dogs and cats. One of the most fascinating is dogs in studies of drugs for epilepsy. If dogs have epilepsy and they have seizures, we can count how many seizures they have over a period of time, and we can get a pretty objective measure of that disease. It's a lot more clear and distinct than something like pain or nausea or discomfort. But in studies of drugs to treat epilepsy, they use placebos, and they find that actually a lot of dogs on placebos in those studies seem to get better. They have fewer seizures than they do if they're not in a clinical study. What does that mean? Well, what it probably means is, as I mentioned earlier for people, if your dog is in a clinical study, you're probably taking better care of it. You're probably making sure it gets all of its other medications, it's getting seen by a veterinarian regularly, it's getting blood tests. Overall, the quality of care that dog is getting is better. So even though it's on the placebo in the study, even though it's not actually getting a treatment, it may do better medically. It may have fewer seizures, even without a drug that actually works. So what's the bottom line? The bottom line is that placebos are not a magical way of healing disease by the power of our thoughts. Placebos are a way of almost, in a sense, fooling ourselves into believing that we're better even when our underlying disease hasn't changed. Now, in humans, that might have some benefit. If you actually feel better, if your pain, if your nausea, if your discomfort is better on a placebo, on something that is essentially harmless, that's okay. As long as, your doctor's not lying to you about it, I think it's okay if those things make you feel better. But I think that's a real problem for our dogs and cats, because if we think a treatment is helping them because of the caregiver placebo effect, and in reality, they're not any better, they still have pain, they still have nausea, whatever it is we're trying to treat, then actually we're doing a disservice to our pets. So it's really important that we stick with treatments that we know work based on good scientific studies, using placebo groups to compare to make sure that we're not actually fooling ourselves and those treatments really work. I hope this has been helpful to you. Thanks for watching. See you next time on SkepVet TV.